Hello everyone, welcome to my channel by my dad Prachi. Today we are going to talk on very famous topic, that is ultrasound machine used in diagnostic purpose. In today's topic I am going to talk on what is ultrasound machine, how it works, what are the types of probes used in ultrasound, and what are the different types of studies done by ultrasound machine. Before starting, please subscribe to my channel by my dad Prachi. Like if you really like the information, share to your friends, and do not forget to hit the bell icon so that you will get immediate notification whenever I upload new video. This is how ultrasound machine looks. Probes are there for different applications, different probes. Key panel is there for different parameters of image. Screen is also there to show you the output, and ultrasound machine comes with the wheel so that one can move it to patient side in emergency case. According to specialties of ultrasound diagnosis, model and look of machine may get changed. So now let's talk on how it works. Basically, ultrasound machine uses high frequency sound waves to make images of organs and structures of inside of the body. Ultrasound machine can capture live and real-time images of body organs and structures. As this technology is non-invasive and non-ionizing, it's considered as safest technique for diagnostic purpose in healthcare sector. Very important functional part of this machine is probe. So we will first know about probes and their types. Ultrasound probes are nothing but the transducer which produces sound waves of very high frequency, which is above the threshold of human hearing. And human hearing threshold is 20 kilohertz, and most of the transducers works in megahertz range. According to frequencies and shape of transducers, there are some types of probes, and the types are linear probe, convex probe, phased array probe, endocavitary probe, and 3D 4D probes. Probes are the only part of ultrasound machine that touches the patient body for procedure using watery gel-on structure as best mediator. So first type of probe is linear probe. Linear probe, the features are large footprint size, rectangular beam shape. Very high frequency used in this probe is 8 to 18 megahertz. Linear probes are generally used for vascular, breast examinations, thyroid, tendons examinations. These probes are very good for superficial examinations. Second type is convex probe. This is also called as curvilinear probe. Footprint size is large, beam shape is convex. They works on low frequency, that is 2.5 to 7.5 megahertz. I want to note one thing, that low frequency probes are very good for in-depth examination. That's why convex probes are used for abdominal, vascular nerves, musculoskeletal, and obstetric gynecologic ultrasounds. There is a microconvex type is also available with very small footprint, which is very useful in neonatal and pediatric ultrasounds. Third type is phased array probes. These probes have small footprint on screen, works in very low frequency, that is 2 to 8 megahertz. That's why phased array offers low resolution but deeper penetration. Beam shape is narrow and triangular but can be expanded if vary frequency. This type of probe is generally used for imaging behind the skull through the acoustic window and cardiac study behind the intercostal spaces. The fourth type is little different, endocavitary probe. You can see probe handle is much longer than other ones. This type of probe goes inside the body cavities and examines inner area or organs. These have U-shaped lens and array. Because of its shape, its range is short but wider field of footprint, even more than convex probe you can see in image. Fifth is 3D 4D probes. 3D probes function same as 2D probes with exceptions of moving array. These probes have moving array inside the probe in sweeping motion and capture slices of images from different angles. These slices are then all put together to form 3D still images, and 4D probes forms images in 4 dimensions to produce 4D live image, that is real time. Now, as there are types of probes, there are different types of ultrasound machines also. According to their specialties, one by one we will see them. The first type is cardiac ultrasound. These machines are specialized for examination of heart and heart vessels respectively. Cardiac ultrasound, also known as echocardiogram, which examines size, shape and motion of heart. Dedicated cardiac machines comes with specialized systems and software that ease cardiac examination and give better data analysis. For cardiac machine, phased array probe is used. Next type is OB/GYN ultrasound machine, which is also called as obstetrics and gynecology. Obstetrics ultrasound confirms pregnancy, determine gestational age, locate the placenta and also diagnose fetal malformations. While gynecology ultrasounds perform imaging of female reproductive organs to access their size and position, the thickness of tissue line and look for masses and abnormalities in female reproductive system. Endocavitary probe is used in this system. This probe is inserted from vaginal cavity and the examinations are done as shown in image. Next type is general imaging ultrasound machine. This type of ultrasound machine cover wider range of applications. They cover abdominal, musculoskeletal, urological, small parts vascular and yes, also obstetric and gynecology studies. Just one should have that particular probe for respective examination because many general imaging systems are upgradation friendly to share services. Just need software upgradation and that particular probe. So those all types of machines works best in safest way. Because of non-ionizing effect, ultrasound is the preferred method for viewing baby in womb. There are some top brands in ultrasound are G Healthcare, Siemens, Philips, Toshiba, Esote and Sonosite, which gives top quality picture and giving tremendous output for their 3D and 4D imaging facilities. Thank you so much for watching till the end. Next time we will learn something new. Till that, keep learning, do your best. Bye bye.